Okay, let's do part two. Hi, my name is Zach Oki. I'm a retina specialist here in Irvine, California. In part one, we read a person's comment which said, I had two retinal tears in one eye and retinal detachment in my right happened spontaneously at the same time. I was 36 at the time with a -5 prescription. What would be the most likely cause? I'd never had issues previously. And then later on, this person clarified, they said, it's just odd that both eyes happen within a day of each other. Allow me to say at the outset that we cannot provide medical advice here. In order to do that, we'd have to examine the eye, conduct an interview, understand the full context. What we're doing right now is merely discussing this in theoretical terms. The most common way in which retinas detach is through an event called a PVD, or a posterior vitreous detachment. This causes a rhegmatogenous detachment. That is, it causes a rip in the retina. As the gel separates away, it can pull hard enough to create a tear, and that tear can allow fluid underneath the retina and cause it to detach. And so therefore, why would we have to ask the question, why did the gel separate away from the retina? It's mostly made out of water, but some part of it is made out of connective tissue, which changes over the course of time. In other words, time causes the vitreous to separate away. Now, if someone is also nearsighted, the eye is longer, and therefore when the gel separates away, it is tighter, and therefore it pulls harder. And also, if the eye is longer, then the retina on the inside of the eye is thinner, it's easier to rip. This is what explains the overwhelming majority of retinal detachment. There's another way in which retinas detach, and this is what we call a retinogenic retinal detachment. It happens almost exclusively in myopic or nearsighted people, in which there are thinning spots. These thinning spots, called lattice degeneration, have little holes which allow a little trickling of fluid underneath the retina, eventually causing a retinal detachment, but not in the way that we discussed earlier with the posterior vitreous detachment, pulling on the retina, creating a retinal tear. It's largely asymptomatic. And therefore, if someone has an asymptomatic retinal detachment in one eye, and let's say the other eye is symptomatic, they'll be under the impression that once a doctor looks at the symptomatic eye, they'll say, oh my God, there's a retinal detachment there. But then they'll look at the other eye, there will be an asymptomatic chronic retinal detachment, and they'll come away with an impression that both eyes happen at the same time, or let's say one day after the next, when in fact one was long-standing and the other one is fresh. I like some other comments that people made. They said maybe Stickler syndrome is involved. One always has to consider that, particularly in young people. This is a connective tissue disorder affecting collagen, in which the lifetime risk of retinal detachment is much higher than the average individual. In fact, people over age 30, let's say, have an 80% probability of developing a retinal detachment in both eyes. Like I said, I'll never really know. No one will ever know until we really get a full history of the situation, examine both eyes. These are just thoughts that we should have if someone says, I had a